So, welcome back to the Health 3.0 podcast, where the innovators shaping the future of healthcare share insights you need to take control of your health today. Today, I've got a great interview for you. I interviewed Dr. Stephanie Estima. Dr. Stephanie is a best-selling author of the book The Betty Body and host of Better, the Dr. Stephanie Estima podcast. She has helped millions of women to understand their bodies, midlife changes, especially in the space around exercise, movement, as well as nutrition and other things as well. What I love about Dr. Stephanie's approach is that this is a different conversation. This is a conversation around movement. This is a conversation around longevity, health span, how women can improve their body composition, aesthetics, and how they can future-proof themselves when it comes to fragility, fractures, and falls. Dr. Stephanie is a big believer in looking specifically at the improvements that you can make in an approach to movement, to resistance training, to exercise that are very female specific. We talk about a comprehensive plan to move forward. What are the things that you should be working on? What are the most critical muscle groups to consider training and at what cadence? How do you do this moving forward from a health span perspective? Dr. Stephanie's got a great depth of knowledge here, a really fun conversation. I really consider her to be a role model in this space. So I hope you enjoy this interview. Welcome back to the Health 3.0 podcast, brought to you by LifeMD. I'm your host, Dr. Doug Lucas, orthopedic surgeon, head of longevity medicine at LifeMD. Each episode, I sit down with the innovators, disruptors, and clinicians redefining what's possible in modern medicine and what that means for your health. Let's get started. Well, Dr. Stephanie, thank you so much for joining me on Health 3.0. I am really excited to have you here.
I am delighted to be here. Thank you so much for the invite.
Yeah, absolutely. Well, and like usual, I want to start by giving the audience a little bit of an understanding of your background. So we're going to talk about some fun stuff today. And you and I were just chatting about all the areas that you're exploring and you're writing on. And I want to talk about some of like your ideas around a book in the future and all of that. So when we get into these ideas around like joints and tendons and biomechanics, I'm always interested how people get to the point where they are in their career where they feel so confident and comfortable with speaking as an expert. So can you give the audience a little idea of like why we should listen to you on these topics?
Sure. Yeah. Well, my undergraduate degree is in neuroscience and psychology. And from there, I went on to complete my Doctor of Chiropractic degree. So I'm a chiropractor. And so this is our bread and butter. We learn like it's a neuromusculoskeletal system that we do a deep dive into. And I've had 20 years ish, a little bit more, 20 years of clinical expertise with my hands on the general public. So I really do understand what it takes to initiate and to continue change, which is one thing to sort of look at an RCT and say, okay, this in theory should work. It's another thing to take that information and apply it to the general population. So for me, the reason why I talk a lot about female specific, so we're going to talk about joints and tendons and ligaments, as you said, and female biomechanics. One of the things that I noticed when I was in practice was you could apply the same stimulus to a male patient and a female patient, and you will get a very different result or a different prognosis based on a variety of factors. But one of the things that I've really honed in on in the last, call it 5 to 8 years, is the difference in terms of our hormonal environment. And when we talk about the, MSK, we have different fiber type, we have different recovery capacity, we have different capillary perfusion. So there's a lot of differences between men and women that can inform our programming and how we show up in our movement strategies. So whether that's strength training or whether that's cardio and conditioning, whether that's rehab or, my preferred is not that we're rehabilitating something but we actually do some prehab. So we actually make sure that the injury never happens. So I think that there's, in terms of why, back of the, envelope answer, why you should listen to me is I have the degrees and I have the miles. I've done the miles. I have the more than 10,000 hours, more than 10,000 patients seen at this point. So I've seen a few things. I sort of have a good understanding of what it takes to make real change in a human body.
Yeah, awesome. Well, and I think something you didn't mention is that you're a great role model too. And that's a big part of your platform.
Thank you. Yeah, thank you for noticing. So I also live what I talk about. So I'm not just on the couch having chips saying, you know what you guys all should do? You guys should all exercise. you know?
Yeah.
So I'm out there too, lifting the weights, pushing the finite, my own limits of my matter, and figuring out what is the point where how we start to understand when recovery is necessary. I think there's a different arc for women as well, where especially women of my age, right? So I'm 48, and a lot of women who grew up with me, in the 80s and 90s and 2000s really, saw this narrative, this persistent narrative, which I actually think is making a comeback now, which is be as small and skinny as possible. And so many of us are overtrained, underfueled, under recovered. And I think when you live in that paradigm for decades, you are going to sacrifice tissue, right? At the altar of being skinny. And that's not just muscle tissue, although that is very important, but you're going to sacrifice bone density, as you very well know, and then the other tissues that actually go to the gym and train with you, right? So the joints, the tendons, and the ligaments. So your connective tissue as a whole. So I think that it is important, especially for women, to understand that when we get into our 40s or 50s or 60s and beyond, it's not just about putting on muscle, although that is a very important narrative that needs to be doubled down on. But it's also about sufficient protecting and having sufficient strength and having sufficient capacity in some of these connective tissues, because you cannot lift heavy weights, let's say, if you have bad joints. Like you can't squat if you have a bad knee or bad ankles, right? You can't do pull-ups if you have a bad shoulder. You can't do push-ups if your elbow isn't working the way that it should, or you always have constant, tennis elbow, right? Or tendonitis. So I think that it's important that we look at the body as a whole, and think about how we can honor all the structures that contribute to our well-being.
Well, what's amazing is that was a very osteopathic statement. So many of you probably don't know my background, and just because I go by Doctor Doug, you never know what kind of doctor that is. And so I'm a DO by training, and DO is a little bit different than MD from a philosophy perspective, although generally practice identically in most cases.
I would consider you a cousin of a chiropractor.
Yeah, well, I mean, if you go back to the origins, right? Like the origins are actually very, very close, and the difference in training is that, of course, musculoskeletal medicine is near and dear to our heart, and we're actually taught manipulation very similar to what you're taught. We're just taught less of it. It's a much smaller part of the curriculum. That was a huge thing for me growing up, and then growing up through medicine, and then as I got into orthopedics, that really works well to understand the human body when you start trying to realign it surgically. And so I think this will be a super fun conversation because all the things that we were talking about before we hit record are things that I dealt with in practice and trying to understand all these different angles and the differences between the female body and the male body. They just are built differently, and we need to take that into consideration when we start applying load and training it. So, man, where do we start? I guess let's start with the joints and the tendons. Because, like you said, man, I get this response all the time, Dr. Doug, you're talking about, doing, high intensity resistance training. You're talking about adding weights like I've never added before, but my knees hurt. And so,
Yeah.
what's your
Yeah.
response to that? I mean, even going back decades, right? Because you get this even in younger women. How do we manage the joint problem?
So joints specifically, well, each of those really need their own soliloquy. Okay, but we'll talk about joints, and then we'll move into tendons and ligaments. But joints technically are avascular, as you very well know. So the only way that you can get nutrition into a joint is through movement and through pressure, right? So when you're walking, let's say, we'll take the knee as an example. So you have someone who has, like, I have knee pain when I squat. The only way that her knee is getting any nutrition through the day is when she is walking. Because what happens, obviously, is you step, you compress the joint, and then you release it. So you allow nutrition to come into the joint and bathe the joint and give, it doesn't have any blood flow of its own. It only works through gradient, a pressure gradient. When we think about tendons and ligaments, they are a little bit better in terms of they do have a direct blood supply. However, that blood supply looks nothing like the blood supply of muscle, right? So if you go and you have like a really great workout, let's say at the gym, your muscles will adapt within the week. Maybe you're sore because it's a novel stimulus, but then, by the next week, you're ready to go again. Tendons and ligaments are much, much slower. I like to call them like the older family dog, like they're super loyal, but they're not the puppies, like they don't get up and jump and run around. They're just kind of hanging around a little bit. And so they're remodeling, and I'll tell you specifically, tendons, the remodeling capacity of tendons is something like 12 to 15 weeks. So the same stimulus. So if you're lifting something in the gym, your muscle is adapting within a week. Your tendons are adapting within like 3 months. And so you can actually out train your tendon capacity, right? So just by definition, by the way, if anyone's like, what's a ligament? What's a tendon? Tendons are basically the bookends of a muscle, right? So they tether the muscle to bone. And then ligaments we have them at every single joint in the body. They tether bone to bone, right? So at every finger joint, there's ligaments to the wrist, the elbow, everywhere. So it's basically keeping the bones together, and the tendons keep the muscle on the bone. So you can, when you first start any type of strength training activity, because you're getting stronger in the muscle so much faster. And then for the nerds that are listening, you'll also know that it's not that the muscle itself is actually getting stronger. It's just the connection from your brain to the muscle that's improving. So your brain is like, oh, okay, that's where that muscle is. I'm going to try and recruit more muscle fibers. So your muscle fiber recruitment in those first couple of weeks, like those newbie gains that we like to talk about, actually is what's improving. But you can out train the strength in your tendons, which is why a lot of people get injured and they're fearful. A lot of women are fearful of getting injured because they have not given the tendons enough time to adapt. So we can talk about, if you'd like, Doc, we can talk about what are some of the things that we need to be thinking about in our strength training program to honor our tendons and our ligaments, because there are, I mean, do you train at a gym or do you have a gym at home?
I have a gym at home and like notorious for, not leaving the house unless I'm driving my kids somewhere.
Okay, okay. So I train at a like a local sort of commercial gym. I I mean, I don't do it anymore, but I used to. I mean, just being a chiropractor, like you can't unsee bad form once you've sort of been trained in that way. There's a lot of bad form out there. And so when we don't have the right form and we're not training tendons and ligaments alongside muscle, injury is almost inevitable. It's almost inevitable. So we want to be thinking about training, and I'll just, I'll let you decide how deep you want to go here, but
Man,
we
go
want to,
go go deep. I mean, the audience is going to eat this up because we don't hear about this very often. So yeah,
yeah.
please.
Okay, so with tendons don't like surprises. This is like my spirit animal. It's like, don't surprise me. They don't like janky movements. They don't like quick, jerky movements. So any of you that are, if the load is too heavy and you have to either use other muscles other than the target muscle to move, or if you have to jerk the weight. First of all, the weight's too heavy, like drop the ego and the weight. So low, slow, and controlled. Tendons need heavy weights in order to get the signal because the blood supply there is reduced, but they need you to control the weights. It's not the other way around. You control the weights don't control you. So slow and controlled movements. They also really like eccentrics. So an eccentric, in case anybody has never heard of that, that's just the lengthening phase of the movement. So if you're watching this on video, I'm curling, I'm, doing a bicep curl. That's the concentric part of the movement. And then as I'm lowering down, that's the eccentric. So this is the point where both the muscle and the tendon and the ligament actually are technically in their most disadvantaged, biomechanically weak position. And in order to grow strength and integrity, that's actually where we need to train. It's like the edge of our comfort, right? Like nothing ever happens. If you've ever read any mindset book, they'll say to you, like, nothing ever happens in your comfort zone. You have to like go to the edge and sometimes beyond. That in strength training, the edge of your comfort zone is eccentric because the muscle is in its weakest position and so is the tendon. It's stretched out really long and therefore it has to work harder to control the weight at that length. So tendons really like that. That is going to send a very strong signal for remodeling. So heavy enough, slow and controlled, and eccentric training is absolutely critical for, I would say, categorically for both ligaments and tendons. I'll also say when we do that, we are able to better control the tensile forces, let's say when if she's saying my squat is bothering me, we are able to actually direct like where the tension is going through the joint to remove some of that pain. So we have to think about heavy, but just heavy enough for you. You have to be able to control the load. Long training, so training in the elongated position, and slow movement, right? Slow and controlled.
Yeah. Awesome. Yeah, those are great rules. Hard to, we talk about that a lot. And I actually have a piece that I'm going to record later today on this concept of heavy, right? Like what is high
Yeah.
intensity? What is heavy? And I think there's been a push into, women must lift heavy. And then there's been some kickback from some exercise physiologists and people in the training space to be like, this is maybe a bad idea. Like you don't have to lift heavy to see gains. So, can you just touch on that for a quick second? Like, what is for you?
Yeah.
Like, is heavy necessary, and what does heavy mean?
Yeah, this is great. I think we talked about this when you were on my podcast, actually. I am in the same camp as you. I think that, first of all, I'll say that women have been like cardio bunny, shrink, 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 skinny, skinny, skinny. And now all of a sudden it's like muscle mommy, like build muscle, right? And then on top of that, so we're totally asking women to change completely how they've trained, what they've been, become accustomed to over years. And now we're telling them lift heavy. So you don't have the neuromuscular control, right? You don't have the motor patterning. Like, I want you to think of strength training as a language. It's fluency in movement, right? In the same way that you would never expect, a 6-month-old to put a full sentence together. They're just babbling at that point. And then when they're toddlers, maybe it's like a couple word sentences. The same is true for your motor learning journey, right? You have to figure out what is the movement pattern that is being asked of you, and how are you translating that movement pattern into your own body. So I think when we ask women, or when we tell women lift heavy, like there's t-shirts that's like lift heavy, expletive, right? It's like lift heavy, SHIT. Um, what we're doing is we're telling a woman whose capacity in her joints, tendons, ligaments, and her muscle doesn't have it yet. We're telling her to put her under a very heavy load. This is a recipe for injury. So I very much think, and the literature is actually pretty clear on this. So 5 reps on the low end to like 30 reps on the high end, as long as you are approaching muscle failure. And I can give you sort of a heuristic for how to think, like how to understand how you are reaching muscle failure. But as long as you are, you don't need to reach it, but approaching muscle failure, you are going to grow both muscle, so hypertrophy of the muscle, and strength of the muscle as well, which are kind of two separate outcomes. So, yeah, 5 to 30 reps. So within that, you are like, the listener already knows, okay, 5 reps is like a certain weight, right? It's usually really heavy. And then 30 reps is a completely different weight, right? It's usually much lighter. So this idea that you have to lift heavy is I don't stand by it. You need to lift, that it has to be 4 to 6 reps or something. Like, I completely dismiss that. I think that you can lift anywhere, like 5 to 30 reps is your range that you can pick within. There's a lot of options in there, and as long as you're approaching muscle failure, you're doing it correct.
Yeah, that's a great way to say it because I love that range, right? That 5 to 30. Because I think a lot of people they love this like almost the cliche at this point of like 5 by 5. Right? If these 5 exercises, you're going to do it, you know, 5 sets, 5 times, it's like 5 reps per set, and
Hmm.
that's okay. Like that is a thing that surely has been studied. But if you're only going to do 5 and you're going to do it almost to failure, like that's heavy, right? Like that's got to be a pretty significant weight.
Yeah, yeah. And the propensity for injury also, like as the weight gets heavier, if you don't have proper mechanics, it's like my chiropractor is showing now. It's like, if your form is bad, right? If your mechanics are off, the likelihood of injury over time accelerates. So we really want to be thinking about form all the time. I don't care it's like, if you can lift the 2 pound pink weights, and you can lift them 4,000 times, I don't care. As long as it is approaching muscle failure, you will build muscle.
Well, and let me hit the other side of that because this is an area where I've trained in and I've helped some people to kind of go down this pathway and look at going at the higher end of that 30 reps. For me, the challenge when I start doing lower weight, focusing on form, higher reps, is that mentally I get distracted and I get bored.
Mhm.
And so for me, I struggle like, am I going to failure or am I going to boredom? right? Like
Right.
I'm just ready to move on to the next thing. So how do you, like, from a mindset perspective, how do you help a woman to get into that space where if the goal is 25, 30 reps, how do you stay engaged in that?
Well, I mean, this is all gonna come there is some personal preference and some agency in here, right? If you dislike a 25 rep set, then you can have a little bit of a heavier rep. You can have a little bit of a heavier weight and do less reps, right? So you can punch out 15 reps, you can punch out 12. Actually, that's where I kinda like to play. I go somewhere from 8 to 15, right? So I don't really do a lot more than that, because like you, I get bored, and psychologically, it's a really long set. Like 30
Long
reps is
set.
a long set. It's like 2, like almost like 2 minutes, you know? So it is really, for me, it's really, I don't like those, but I'm offering that as an option because I can't assume that everyone wants to train like me, right? I sort of like the 8 to 15. That's where I like to play. I will do my heaviest weights somewhere around 6, 7, 8, and I will do my highest reps somewhere around 15. Okay. And if I can get past 15, I know it's time to increase the weight. So just to give everybody maybe an understanding of what heavy enough looks like or how you're approaching failure, what you want to think about within the set, whether it's 50 or 15 reps or it's 30 reps, is your velocity in the execution of the set starting to slow down? So, in other words, was rep 1 and now let's say you're at rep 20. Is 20s you're starting to struggle to do it as quickly as maybe set 1, 2, or 3. That's one thing. The other thing is how is your range of motion, right? As you're approaching failure in whatever, like whether it's a squat, it's a pull up, it's a pull down, it's a push up, whatever it is, you're going to start struggling to execute the move in a full range of motion because the muscle's getting tired. And then depending on the force curve, that's going to change for a variety of different muscles. So we have velocities changing, full range of motion is now starting to become very difficult. And the other thing is like your subjective um feeling about the weight. It's starting to feel a lot heavier. Okay. Even though it's still 20 pounds or whatever the weight is. The weight, obviously, the stimulus is the same, but subjectively, it starts to feel heavier and heavier and heavier and heavier. So, those are sort of three things that I would say, like to kind of work through almost like a heuristic. Like, what are some of the ways that I know that I'm approaching muscle failure? Your velocity is changing in the set. The subjective weight is starting to feel much heavier. Full range of motion is becoming more difficult. I think that those are really good things to pay attention to.
Yeah, that's awesome. Because I'll say like, oh well, you have to, if your form starts to fail, then you probably need to be considered that you're getting close to failure. But people
Oh,
don't know what
form
I
is another
mean
one.
by that. Well,
Yeah,
but
yeah,
you
yeah.
kind of described it well, right? So like the velocity is changing, right? Like the range of motion is changing. So I think that sort of describes it well. And then for me, like I'll start to notice that my form is failing. And there's like I'm actually taking over with my stronger leg than my weaker leg. And I'm like,
Right,
okay, like
right.
this, we got to call it. This is going to result in an injury. So yeah, that's so good. I'd love to switch to biomechanics
My
because
favorite.
it's so critical. And this is where I remember when I was originally like training in orthopedics and we start looking at alignment, it really surprised me the differences in alignment when you start really like looking at it like segment by segment, right? So like the foot, the tibia or like the leg, the thigh, the angle from the pelvis to the knee. And then you look at it across the spectrum of both men and women, and there is some overlap. But wow, the human body is built actually very differently from one
Yeah.
body to another. And this is really important because my squat, I'm sure looks different than your squat. And that doesn't mean that my squat is better or worse or yours is better or worse. Our bodies are built differently. And there's some gender differences there, but there's also within gender differences. So, where do you want to start with this? Because this is a big one.
Oh, I have to say just, as an aside, so this is probably gonna be chapter 5 in my book, okay? So I've already written it, and I was meeting with the publisher, we met the other day, and I was like, I know I can't have favorite chapters, but this is my favorite chapter. This is the reason why I became a chiropractor is because of biomechanics. Like, I'm obsessed with movement. So to your point, you're correct, there are some really big differences in our skeleton, and then of course how that skeleton moves. So the biggest one whenever I'm speaking on stages, I'm like, what do you guys think? What is the biggest difference between a male and female skeleton? And like everyone will say pelvis, hips, right? And you're right. The biggest difference is the wider pelvic basin that women have. So not only is the ilia, which are like the two bones that make up the hips, wider, but the shape of the hip is actually different. So if you look at a male pelvis, the pelvic inlet or basin almost looks like a heart shape. If you look at a woman's inlet, so basically the shape that those two hip bones make, it makes a big oval shape. And most people can sort of guess why that is. It's for pregnancy and and then for the baby to pass through that when you are delivering. Now, whether or not you want to get pregnant and have children, that's a different conversation. But your skeleton is based on, like the wider pelvis, is based for childbearing. Um, why this is important is because the angle now, when we have wider hips, the angle between your hip and your knee. So again, for the nerds listening, this is the ASIS or anterior superior iliac spine to the patellar tubercle. Um, or basically, if you're not a nerd, it's like from the hip to the knee. That angle now, women become more knock-kneed, right? So the knees have more of a biomechanist, we'll call this like more genuvalgum. Basically, like the knees almost are like kissing a little bit more. They're coming in a little bit more. And that is going to affect when a woman, every step she takes, when she runs, when she sprints, when she squats, when she lunges, right? Because her knee now, that when she bends that knee, that angle, I think that it's like the variance between men and women is like 3 to 8 degrees, something like that, right? So every time she comes down for a Bulgarian squat or a lunge or whatever, whether it's bipedal, like 1 foot or 2 feet, there is going to be more pressure on the inner part of her knee. And there's some literature that also suggests, and we can get into it, around injury risk for female athletes at the knee. We tend to see a lot of female athletes tend to blow out the MCL, the medial lateral collider ligament, and the ACL, the anterior cruciate ligament as well. So what I will say is this is a feature, not a bug. Okay. So I know that often, so I want to just say that like, it's not that you're broken. There's nothing wrong with you, but just understand the map so that you can follow the map, you know? So your map is different than, your partner or your brother or your personal trainer or whatever. And the way that I always am of the opinion that the dynamic control that you have is far more important than any static angle. Like your angle could be 20 degrees. It doesn't matter. You can create more stability in the pelvis and in the hip, just understanding that you have this extra, feature to think about. Okay. So this is why I'll talk about, and you'll see this when the book comes out, really talking about developing control with some of the hip extensors and the muscles on the side of the hip, so that when, especially in one-legged, like unilateral movement, so when you're walking, when you're running, when you're sprinting, when you're lunging, when you are just on the one leg, that you can exert control, dynamic control with the glute medius. Glute maximus also plays. These are glute muscles. And then the tensor fascia lata, which is another muscle group that I talk about and love, that provides a lot of stability to the pelvis. So that's one way that we're very different. Another way that we're very different is something called the cubital angle or the carry angle, which is the angle that we make with our humerus to our forearm. So if the Q angle makes us more knock-kneed, the carry angle makes us more knock-elbowed, right? So again, there's something like a 2 to 6 degree difference in terms of increased angle for the elbows. Part of that is just to allow for a flare because our hips are wider. Which actually, by the way, Doug, this is
Your
why I
hands
hate.
your hands have to clear your
Yeah,
hips
they
as you
have to.
swing it,
Got to
right?
clear the
Yeah.
hips.
Yeah.
Okay, so let me tell you, this is my pet peeve. I don't think I've ever talked about this before, but I'll tell you, I cannot stand when I hear, and it's bros. It's usually fitness bros, but like surprisingly, also a number of women too. They'll say, you know what the best longevity test is? Farmer carries.
Yeah.
Why is that? Why does that not work for women? Because every time we take a step, we're going to bang that damn dumbbell on our hip, like I do, like every time I walk, I'm like, okay, I have to like shuffle. So I
Right.
have to sort of,
Right.
so then I'm abducting my arms, like I'm holding the thing. So now it's not just like a grip strength test. Now it's like, okay, how strong are my lats and how strong are my lateral deltoid? So I personally hate farmer's carries in the way that they have been described as this like longevity. Can you hold like I think it's half of your weight in each arm? Can you walk certain amount of steps? Like not for women because we have hips. So
Well, and let me just interrupt that for a second because that is such a critical thing. Is I so many of my audience members, just in all the places that I am, are women, especially older women, and they're listening to me and people like Peter Attia, and I love Peter's work, but he talks about farmers carry all the time, and we talk about farmers carry because grip strength is important and fall
yeah, it is.
prevention and all this stuff.
It is. Yeah.
But we don't talk about the differences here in gender and like why it is more challenging. And so it's funny, like I actually I had an elbow injury when I was gosh, I don't know how old I was, young adult, bike accident. Like I was racing on a road bike and crashed and ended up with a radial head injury, which is one of the bones in the elbow for those that don't know that. And so actually my carrying angle is different on one side versus the other as a result of that
Right.
injury. And it is on the side, which is my stronger side, my right side, I have a bigger carrying angle and I can't farmers carry as much on that side. So it really does change the way that you can load. My left side is so straight, it's just like a straight load and I can carry so much more on that side than I can on my stronger side because of the change in the biomechanics. So yeah,
Yeah.
I'm glad you
Yeah.
brought that up.
I'm really glad that and not that I'm glad that you had a, radial head injury, but I think but I think that it gives you some perspective too, right? Because we are I think women are constantly inundated with all of this information, which is good information, but it's information that's based on the male default
Yeah.
body,
Right.
right? So a farmer's carry is a fantastic longevity. Peter is, a Tia, like all respect to him. I love his work. I followed his work for years, but he's also talking about it potentially without considering maybe how this might affect women. Maybe because he's not aware, or maybe like, I don't think a lot of people are aware of it. And so when I look at information that's being, signaled, this is the longevity tool, and I go and I try it and I feel like an abject failure, it's, it's not because my grip strength is weak or there's something, my grip strength is, I can do it like a almost 2 minute dead hang, but my hips won't accommodate for the farmer's carry, right? So it's just that the information just needs to be tweaked a little bit to accommodate for, for the wider hip in this case, for the, for the wider Q angle that, or the wider hip that women have.
I'm glad you brought up the dead hang because this is, I think, in not that I need to defend Peter by any means, but in his defense, he's usually just talking about the research. But as you stated, the research is universally on men. And so it's like, well, these are the thresholds that you need to meet, and these are driven by male driven research. But another one you can do then is the dead hang, and that is going to be very grip strength related. And there are thresholds for women versus men, and yeah, so there is more, but that we do hear a lot about farmers carry, and I see a lot of our community members trying to do farmers carry and being frustrated by the results.
Yeah. Yeah. And I think for women, at least my experience with speaking with and caring for hundreds, maybe thousands at this point of female patients is this: what we do is we don't our first thought is not, maybe this program wasn't meant for me or it wasn't tailored to me. It's like maybe there's something wrong with me. You know, maybe there's like my grip strength, or I'm a loser, or I'm not. We tend to think about the default or the defect being endogenous within, rather than the program or the overlay not being meant for us.
I see that. I totally see that. So we mentioned Q angle. Gosh, we talked about knee. I'd love to double click on that for a second. I think for our younger audience, especially, there are so many women out there who were involved in the sports where this is really a big issue, specifically like soccer, basketball, right?
Yep. Yep. Yep.
And there we could talk about the forces of that if we wanted to geek out on it. But ultimately, like, how do you then, as a midlife woman who is looking at being active in the future, if you've had an ACL repair, or maybe two, or maybe revisions times two, as many of my younger female patients have had, right? Because they just keep suffering from the same thing.
Hmm.
How do you then take that position, that starting point, and look at the idea like how do I train my quads? How do I train like in a biomechanically favorable position for the rest of my life? Because that's what we want to talk about, right? This is longevity, health span related. Okay, you had these injuries, but then where do you go from here?
So there's a couple things. I think that if we are thinking about, if we're going to zone in on the knee specifically, the one actually thing I will mention is knee osteoarthritis, which I'm sure you're very familiar with, is I think the leading, is it low back? No, I think it's knee. I think it's knee OA, which is the number one disability worldwide in terms of like a mechanical, a mechanical issue, followed very closely by low back pain, right? So like those two are the big ones. So when we're thinking about if you've had any type of ACL, MCL, LCL, PCL, anything in the knee, like ligamentous, meniscus, or otherwise, anything that's not muscle. One of the things that we want to be thinking about is how can we reintroduce elasticity. I'll give a kind of a visual with the feet and I'll come back to the ankle because I think it's just an easier visual for people. If you were to try and jump, and actually this involves the knee as well, the way that you're going to jump higher if you're just standing from a standing position, is you're going to bend the knee and you're going to dorsiflex the ankle. So basically, your knee is going to come over your toe, right? So the knee and ankle are going to bend, and then you're going to jump up. You're going to use your muscles, but you're also going to be using something called the elasticity in your tendons as well in order to facilitate that. So your tendons have to stretch and then you're going to bounce up and then you have to land, right? So this elastic recoil, this springiness that we have in order to facilitate that motion tends to get lost in midlife, and it's not anyone's fault. It's not because you were training wrong. It's just you weren't training for elastic recoil, right? You were probably on the cardio machine doing like steady state cardio. Maybe it's on an I'm doing an elliptical motion
I
with my
see that.
hand
Yeah.
if you're
Or
watching on
Stairmaster. I
video.
don't know which one
Yeah,
that
or
is. Yeah.
Stairmaster. Yeah, it could be Stairmaster, could be treadmill, could be recumbent bike, like basically any gym cardio equipment. Most people get on it and do kind of like a steady state thing for 30 minutes, 40 minutes, 50 minutes, an hour, whatever it is. Okay. We're not training spring. We're not training recoil. And that needs to be a part of our training in order to rehab if you've had an ACL injury, like plyometrics and spring training absolutely need to be part of that. Even as simple as, you're on like maybe a 6-inch box and you step down on it and you just land the step, right? So there's a couple things that are happening there. One is that you are training spring into the tendons and the ligaments, but you're also training something called deceleration, which is coming to a full stop. And that is something that also is not often trained, even in the sprinting world. Like I love to track sprint. I used to be a track sprinter. Um, stopped for many years when I was, in the early years of mothering and having very young children, and have kind of recently come back to it and just remembered how much I loved it. But sprinting, obviously, there needs to be a lot of springiness in the tendons, so you don't like rip the Achilles off of the heel, and that you don't injure your knees. But you also need to be able to come to a stop. So things like walking or like jumping or, first I would say stepping off and then maybe progressing to jumping off of like a box, like a plyo box, I think are, all that needs is, 5-10 minutes at the end of your strength training program, whatever, day it is, even if it's leg day. And you are going to, because the tendons and ligaments are primed at that point, because you've just strength trained and there's blood that's circulating, et cetera, putting in some elastic recoil, plyometric training, and deceleration training, I think is really, really important. And deceleration training, just again for the nerds who are listening, if you are an athlete, that is one of the biggest predictors. Not that we want to be athletes going pro, but it's actually the biggest predictor of whether an athlete will go pro. It's not their vertical jump, it's not their speed, it's not their acceleration. Like if you think about basketball or soccer, God, any sport, hockey, you're not just like dribbling the ball in a straight line to the other basket and sinking it. You got to like stop. You got to get around the opponents. You got to change direction. You got to weave your way across the basketball court in order to, or the soccer pitch or whatever it is, to get the ball into the other opponent's net. Now, while people listening are like, that's nice, I don't want to be a basketball player. You also need to, as a woman, as you start to, you're menopausal and you've lost a lot of the hormonal, let's say, concentration that you once had, your tendons and ligaments are changing as well because they are very much influenced by estrogen in particular, we see with the loss of estrogen, our tendons actually are not as stiff. And what you want is a stiff tendon. Like that is the goal. The stiffer the tendon, the heavier weights you can lift, the healthier the tendon is. When you lose that, your tendons become weaker, right? They don't turn over as much as well because estrogen is really involved in like collagen turnover, and tendons are primarily made of collagen. Um, so we see this loss. And then just fast forward, let's say you're a 55, 65, 75-year-old, maybe you're a grandmother and you step on your grandchild's Lego, or you trip on the corner of a rug, or there's some ice at the end of the driveway because it's really snowy. You need to decelerate. You need to like, if you're falling forward, you need to stop. Yes, you need to stop. And in order to stop, you need to have that elasticity and recoil in the tendon, and you need to be able to activate some of the muscles that are involved in deceleration. So, yes, it's like really like sexy to talk about it in like sports. It's like you got to be able to dribble around around the player, but it's also like a life skill. Right? You need to decelerate, come to a stop, and be able to change directions also. Because if you fall, I mean, I know you've talked about fragility postmenopause and like the bone density changes that a lot of women will experience. If you fall and crack that hip, like it's hard to come back from that as a 75-year-old woman. You have to really think about preventing that at all costs.
At all costs. No, totally agree. And I will say, like, I don't know how old your kids are. My kids are 13, 12, and 7. And man,
Mhm.
nothing hurts quite so much like stepping on a Lego. I don't know what it is about the corners. There's something unique about a Lego
It's
that's
so true.
really, really painful.
It's the word.
Um,
I would rather step on a nail. Like I don't know
yeah,
what I'm hopping around like, a cartoon character that just stepped on fire or something.
yeah,
Like
yeah.
Legos are the worst. Yeah.
It's the worst. I agree.
Mhm.
So, anyway, yeah, fragility fractures, preventing that hip fracture. That's something clearly I talk about on my own platform, in my community. And this is, you're right. It's like being able to catch yourself. And one of the things I love to say is like, we hear people look at the way I work out and they're like, why are you doing all this weird stuff? Like, shouldn't you just be doing like back squats and deadlifts? And I'm like, no, like the more, and I want to get into how we train for women, but like the more variety I can do, the more stuff I can do on like one leg or, off balance, challenging myself in these different ways. That's strategic, right? Like, cause it's not a matter of if you fall, like we don't live in padded rooms. We're in the environment where like steps are uneven and like there's a snowstorm like hitting me right now, right? Like it's going to be slippery outside. Like I know I'm going to slip when I'm walking my dogs later today. It's a matter of being able to catch yourself, hopefully before you hit the ground. And then when you do hit the ground, preventing yourself, like as you hit, can you decelerate with your arms before your face hits the ground? I mean, all of those things are kind of hard to imagine, but if you watch some of these falls in especially elderly individuals in slow motion, they don't react at all, right? They fall and they don't even get their hands in front of their face before their face hits the ground. And this is why the fall is so catastrophic, is because they've lost the ability to accommodate, the neuromuscular ability, and then also the power to decelerate in that short range of motion with the upper extremities. And I mean, never Google that if you're sensitive to it, because it's incredible to watch an elderly person fall as they're breaking their hip and as they're getting these head injuries, literally just from falling from a standing height. So yeah, totally agree. It's not sexy to talk about, but man, it's critical from a longevity perspective.
One of the things I actually wanted to highlight that you just said, which is so brilliant, is all the different movements that you do. And I think that this is something that I would like to see more of the women who follow me and follow you embrace. When we think about, if you're just thinking about like a financial portfolio, you would never just only buy Google stock, right? You would diversify. I mean, hopefully.
I mean,
I'm not giving
it would
financial
have
advice.
worked out
Yeah.
actually, but
Yes, yeah. If you just bought Bitcoin at 2003. No, but if you just buy one stock and put all of your hopes in that, like, this is not financial advice, right? But you are you are really just hanging your hat on one thing, right? Versus diversifying the even like the markets that your money is invested in, that, whether it's a stock or it's an ETF or it's a, private equity, whatever, right? You're like, the point I'm trying to make is that you are diversifying where your money is growing. And the same way in the gym, diversifying your movements is actually what keeps you young. When you are only doing the elliptical for 50 minutes and then you are only strength training, whether it's, you're doing heavy or whatever it is, that is not, unfortunately, that is not enough to age well. Like you also need to be, you need to be working on balance and proprioception, like you were saying, like the one-legged stuff, taking your eyes out of the equation, which is, I don't know if we'll go there today, but this is our dominant sense, right? You close your eyes. I mean, you've seen, I used to do in practice, I used to do like the Trendelenburg test, which is basically a patient will stand, lift one leg, and then we're actually
Mm,
looking to see the integrity of like, can the hip not drop? We want to see the hip
right.
stay level.
Yeah.
And then, so I would get them to do that. And then I'd say, okay, now close your eyes. And then, they can't, no balance, right? No. And then
Right.
and it's like, I would always do it near a wall just in case, right? But, can you take your vision, the dominant, like, can you actually train your proprioception, which is
Mm.
what I would call the sixth sense or the invisible sense that we have, where like the position of your joints without looking at them. So there's a lot of different ways that we can be training. And I think that the people who embrace this idea of a diversified movement portfolio, okay, they tend to not get injured. And the ones who just stick, the hard-headed, stubborn mules that are like, no, I'm just going to work out this way because that's what I know, their bodies are broken. And you've probably seen this in practice, and I've seen this in practice. Like you see the marathoner who refuses to strength train, or you see the bodybuilder who refuses to do any mobility work. It's like those bodies break down so much faster and they age so much faster when you don't diversify the movement.
And get injured so much faster.
Yeah,
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 I
yeah.
mean, I've
Mhm.
noticed in my own, you mentioned you were 48, I'm 47. We are in this like midlife moment where if I don't diversify my training and then I try to do something that's outside of my comfort zone, it might be good from a mindset perspective, but oh my gosh, I'm so weak. And it just what stands out to me is I'm going back to Costa Rica. I love Costa Rica, such a fun place to visit. And whenever I'm there, like I pretend that I know how to surf, and I don't spend a lot of time working on like back extension and like really training mobility in my shoulders. And when you watch people that know how to surf, I mean, you can see them. You can imagine in your mind somebody on a surfboard, in a back arch and like swimming all day long, and like it just looks so graceful and easy. I feel like a polar bear on a surfboard. I mean, it just is so uncomfortable. And like I can only hold that position for literally like 30 seconds before my back is fatigued. And I'm a pretty fit guy for a non-athlete desk jockey, but I consider myself relatively fit, and I'm so weak when I try to do that. And it's just such a great example where like I don't train that. So I don't know why I would expect that I'd be able to go out there and gracefully, glide around on waves all day. Um, and if we stick in our little comfort zone from a training perspective, then we're going to get in trouble one way or another. Because again, we don't live in a padded room. Like we have to live life, or at least we should be living life, and getting out and pushing the envelope. But we have to train for all of that.
I couldn't agree more. Yep. Hmm.
So then let's wrap this up with maybe the third piece here is how do you actually how do you train as a woman? And I have training programs that I've built, and but honestly, I mostly work with men. Actually, that's not true. My last trainer was a woman, but she very much treated me like I won't say what she treated me like. It was hard, but it was very manly. Um, so how do we train women?
Well, I think that I'll say this, muscle on men and muscle on women it's the same tissue, right? So it's like you have to give it sufficient stimulus for it to grow. It's no different. Like there's no gender, nothing different about muscle in women than there is muscle in men. However, there are very distinct, we'll say, preferences, gender preferences, where women want to be building. And I would say a lot of women I think, maybe idealize thinking about something that looks more like an hourglass figure, where we see a small waist, we see a flare from the waist into the glutes or into the lower half of the body. And then I don't think a lot of women think about the upper body, but I think that will balance when we're thinking about training an hourglass figure. We want to be balancing the top with the bottom, right? So for women, I would say that when we're thinking about lower body, I already mentioned in terms of a functional perspective, the glutes are very important for training hip stability, especially with overcorrecting, let's say, for that Q angle, that increased Q angle. So there's three parts to the glutes. You have glute max, med, min. So it's just basically big, medium, and small glute. And they're all sort of layered on top. You can't really see glute minimus, but you can see max. That's the biggest part of of your behind. And then glute medius sits just superior to that, just sits on top of it. So it's often called like the upper shelf. I would say that those are not only maybe they compete probably with the quads for the title of like biggest muscle in the body. But for women, at least like top two, right? It's like one of the biggest muscle groups in the body. And actually, I should say that 58%. So women carry more muscle in the lower half of their body than men do. So we have 58% of our total muscle mass in the lower half of our body compared to 52 in men. So it's a significant difference. So I would say training the glutes. The glutes are really interesting because they are both a mix of type 1 and type 2 fibers. So type 1 is what you might refer to as like a slow twitch fiber. Type 2 is what you might refer to as fast twitch. So you need to actually be trained. Like the glutes are maybe the most, I mean, in my opinion, from a functional perspective, like aesthetics, sure, they look great in a pair of jeans. But I would say from a functional perspective, they connect the upper body with the lower body via the sacrum and the pelvis. They connect the hip to the leg via the tensor fascia lata and the iliotibial band. They help to stabilize when you're bending down, let's say forward flexing, that you don't over flex, right? So, like we have attachments like the glute medius will protect the spine from over flexing and overextending. They're involved in everything: external rotation, internal rotation, abduction, like literally everything. So training the glutes for women is very, very important. If you want to fill out your jeans, like I'll sell you on the aesthetics if that's what's going to get you to do it, but also just from a functional perspective as well. Um, so I would say training the glutes probably number one, and I would say hamstrings as well. I will bunch in hamstrings as the leg flexors because they tend to be weaker than the quads in women. A lot of women tend to, even when they're doing squats, will say, "Oh, I feel it in the front of my leg. I don't really feel it in the back. I don't really feel it in the hammies. I don't really feel it in the glutes." A lot of women are what I would say quad dominant. So I would say hamstrings and glutes are very important for women. I would say, um, obviously, the size of your waist. There's a couple of contributing factors that go into that. Obviously, diet is a big one, but you can also I think a lot of women who've tried to like shrink and get skinny and always get small, um, don't realize that with strength training, I mean, you can't spot reduce anything, but you can spot build with strength training, right? Like you can put on muscle in specific places. So I would put them on in the glutes, and in the upper body, I would develop out the shoulders because that's visually the top of the hourglass. But again, I'll sell you on the aesthetics, but it's also the function that you get with it. Like shoulders, as you know, the shoulder joint, just like the hip, has so many degrees of freedom, right? So you can flex, you can extend, you can abduct, you can adduct, you can externally rotate, internally rotate. There's so many movements that the shoulder has. So developing stability through the musculature that surrounds the shoulder is a really great idea. So you're not only going to look good in the tank top, but you're also going to protect the shoulder. Specifically women, we tend to get frozen shoulder. We tend to get really aggravated shoulders, like pinchy shoulders. So developing out, again, the muscles on the side of the shoulder joint, the deltoid, very important. And then, I talk about this, I'm going to be talking about this in the book, and then the rotator cuff muscles and the lats and all the things. So those are kind of the two areas that I would really hone in on, is like the back and like the rotator cuff, the lats and the deltoid and the upper body, and then the glutes and the hammies and lower body.
Amazing. I love the way that you bring it to the aesthetics because it is. I think a lot of. I mean, and some people will say like, "Oh, well, you shouldn't consider aesthetics." I mean, it's important, right? I mean, we
Yeah.
generally are going to see ourselves every day, and there is a component to like when you look in the mirror, like what are you looking at? My audience also tends to be older, and I also love to say like when you're talking glutes, like that's your ability to get up off the toilet. I mean, we start talking about these simple things like can I still tie my shoes or do I need some Skechers slip-ons, right? Like it's the difference between some of these very, very functional things. And I love that you bring up shoulders too, because this is a joint that if you ignore the shoulder, boy, you're going to lose that. You're going to lose that mobility. And it doesn't sound like a big problem until you can't do your hair anymore, right? Like until like you can't get here. And we
You can't
see
hook your
this.
bra. You can't unhook your
Yeah,
bra
right,
because you
right,
can't internally rotate and
right.
get the clip off. So yeah, the shoulders involved for women, like you said, it's like brushing your teeth, combing your hair, to unhooking your bra, even just picking up groceries, right? The shoulder has to be strong and so do the lats to hold the arm close to the body.
Yeah, and unfortunately, I see a lot of times this doesn't get recognized until you have like a fracture, for example. I used to treat a lot of upper arm fractures, shoulder fractures, and it doesn't matter if you treat that surgically or non-surgically, loss of range of motion is inevitable. And so like that's always the goal. Like, oh my gosh, can I get back to me being able to brush my hair? Can I get back to being able to put on a bra, unclasp a bra? Yeah, so it is such a big deal to train the shoulder, keep the shoulder strong. And then, yes, I think one of the biggest mistakes that I see so many women make when I have this conversation around strength training and resistance training is I don't want to get too big. They say I don't want to get bulky. So, God, I know. Can you? I
A
have a
girl
statement that
can
I make.
dream. A
Oh,
girl
yeah.
can continue to dream to get
So
bulky.
tell me, like, have you ever
Yeah,
had? Because I'm sure you've helped. I don't know how many thousands of women to train and learn how to train. How many women have you seen get too bulky?
this many, 0.
Yeah, that's
Like,
a 0 for those
that's
who
a
are
big
listening to this.
fat 0. I love the aesthetics conversation too, because I think, I wanted to I'm gonna address the bulkiness in just a sec, but I just wanna say that it's okay to wanna look good. I think
Absolutely.
that there's been, that's how I got into strength training. I'm gonna be honest. That's how I was like, I wanna look good, I wanna look good in the summertime, I wanna look good in a bathing suit, all the things. It's okay to train for looks because at the end of the day, you are as you were saying, like your relationship with yourself is the most important relationship that you will ever engage in. You can't be a good mother, a good husband, a good wife to your husband, or a good partner, or a good wife to your wife, whatever. You can't be if you don't love yourself. It's going to be very hard for you to love others. So I think if one of those verticals is loving what you look like in the mirror, it's like, yes, more. Give me all I want to love what I see in the mirror. So I love giving women permission because I think that we've been told, there's many things that women have been told, but I think it's like you can't want to do it for looks. So we secretly still want that. But then there's this chiasm, there's this division that happens within us, right? We are like, but I want to look for looks, but then I know I should want to do it for my bone density. It's like, okay, but you can have both. It's a yes and. It's not an either or. You can have the aesthetics and you can have the function. You can totally train for both of those things.
Yes, that totally agree. And I try to relate this to men too. I think men, it's a totally different paradigm. But it's the same thing where I see men who are afraid to talk about, that they do look good and, or that they want to look good or that they want to look lean or that they, like they want to build that shoulder, like I want that shoulder cap, but they're afraid to say it out loud because it's been stigmatized that like we shouldn't want that.
Yeah.
And so, yeah, we hereby give both women and men permission to want to look
Yes.
good and to train
Yes.
for it. Yeah.
And coming back to the bulky thing, I actually was just thinking, I wrote a whole thing about this. I haven't published it yet, but it'll probably come out in one of my newsletters. I have 2 teenage boys, so mine are 15 and 13, so very close in age to yours. And I think watching them right now, like they're super into weight training, which is actually really fun because it's like, all right, I've been training for 20 years and my 15-year-old is basically training the same numbers as I am right now, which is really humbling. And it's like, oh, wow, the testosterone really does work. But I will say that one of the things I think women have been robbed of is this phase that I'm seeing my boys go through right now. This like winter arc, like October 1st comes around and like, all right, I'm building. I'm going to build now. So I'm going to increase my calories. I'm going to take in more protein. I'm going to weight train. I'm going to give myself sufficient recovery. And so like the winter arc if those of you have never heard of that term before, I have just learned this, is like over the winter, so October, November, December, January, February, they go into like essentially what's like a bulking season, right? So they'll train because they're trying to grow muscle, and then February comes around and then they'll say, "Okay, I've put on more mass, I've put on more tissue, all kinds of tissue, tendons, ligaments, I've put on muscle
And some fat,
and a little bit of
and
fat."
that's okay.
And then so they're like, "Okay, so now I'm gonna go into like a mild caloric deficit so I look shredded for the summer." But what I realize in training with my boys, especially my 15-year-old, because I like to train with my 15-year-old, right? And my 13-year-old still just wants to run around the gym a little bit too much. So I train with my 15-year-old. Is that teenage girls are not doing the same thing.
No.
They're like counting and when I was a teenage girl, I never did any winter arc bulk. I never did that, right? It was like, how tiny can I be? It's like counting out the almonds and measuring out the grapes for my snack and how small and how skinny and and that is what I think that's been stolen from us as women. It's like the theft that didn't have a name until I saw my children, my boys, completely taking pride in seeing how their body responds when they give the right inputs to it. We were never given that. And so I think that's why you tell a woman in midlife or beyond, a menopausal woman now, lift heavy weights or lift weights, have more protein, have more calories. And like, but what about getting bulky? I'm scared of that. They've never actually seen what it means to consume, to have calories in a slight caloric surplus, to see what happens to their muscle mass, their overall figure. They've never seen it. So they're petrified of it.
So I see this a lot, and I actually get this. I have like a town hall for my community every week, and every week I get the same question, which is, "Hey, I'm following your general guidelines of increasing protein, mostly from animal sources, and I've gained 3 pounds." And it's almost like always the same. It's either like 3 or 4 pounds. I've gained 3 or 4 pounds. So my first question is, well, are you looking at your body composition? Because your goal is to build muscle, right? I'm assuming that's why you're doing this. So if your goal is to build muscle, do you know what's changed in your body composition? And universally, the answer is no. And then if they're open to it, I'll say, well, how much do you weigh? And they usually weigh like 115 pounds. And I'm like, well, that 3 pounds is probably good for you. I don't know what your aesthetics look like. I can't see you, but like this is probably a good thing. And it's so hard for them to understand that like that ultimately is the goal. Now, I don't want them to gain 30 pounds. But if you're going to be anabolic, especially in my community of women with osteoporosis, the goal is actually to build muscle and bone, which will result in a change in the scale in a positive way. And so it is like this mind, it's so hard for them to understand that like that is
Yeah.
actually the goal. They've for decades been pushing the opposite direction as hard as they can.
Yeah. And this, like you said, the scale, I mean, honestly, if I had my way, I'd have every woman throw at their scale because it's such a it just messes with their mind way too much. To your point, if someone has gained 3 pounds, I mean, maybe it's muscle. It's probably also some water that's being held in the muscle, which is great. But if you're going to be strength training and building muscle, the goal shouldn't be to weigh the same as a toddler. It's like the goal should be like putting on more weight in the right way. Like if you
Yeah,
put on 3 pounds, let's pretend 3 pounds, let's pretend it's all muscle. Okay. But you lost 3 pounds of fat. What's your scale going to tell you? Nothing.
nothing.
Nothing happened.
Yeah,
But are you fundamentally orders of magnitude in a better place now?
right.
1000%. So, I mean, I'm sure you talk about this. I love a waist hip, like the waist hip ratio. Okay.
Mm-hmm.
It's cheap.
Yeah.
Everyone has a measurement somewhere, or just go to Dollarama or whatever and get one, dollar store and get one. Measure your waist, measure your hips. Okay. If your hips are getting bigger because you're hip thrusting and lunging, that is a good thing,
Mm-hmm.
right? It is a good thing for that to happen. If your waist is going down because you've lost visceral fat and you've decreased your adiposity, that is a good thing.
Yeah.
It doesn't matter if the scale says 3 up, 3 down, no change.
Yeah. It is hard. I love biomarkers. I love data. But there's good data and there's data that's harmful. And then over tracking. I mean, I see this whole like orthorexia thing where people are just they're over tracking, right? And like I've fallen into that too. I mean, I got my own challenges that I've talked about on this podcast before because of my background in climbing as a weight driven sport and then also in ballet for years and years and
Right.
pushing that same aesthetic as the women, right? Like we also
Right.
had to be very lean and constantly lean. There's no off season in
Mhm.
ballet. And so, yeah, it's really challenging to find that line, and that's where I love the idea of customizing it for everybody, for women and for men, but definitely for women because so much of this is driven around the male identity and athletics, aesthetics, medicine, all of it, and so what is right for you? So then let's round this up. What's the next step forward for women in this? Where can they go if they're looking to improve their training, if they want to change the way that they see themselves, as the athlete that they're becoming in whatever stage of life that they're in. So where are the places that they can either, they can find you or resources that you can direct them toward? What's next for them?
Thank you. I really appreciate that. I mean, if I may be so bold to offer that, I was saying to you before we got going, I've developed a program called Lift, which is a joint friendly, form focused program for weightlifting for women in midlife and beyond. Whether you want to be training 2 days a week and you're new to the game, or you're a season, you've been training forever, we go through, and you want to be training 4 or 5 days a week. There's sort of like a choose your own adventure within there, and we sort of guide you along that pathway. I would say that that is if that is something that interests you, you can certainly check that out, and I'll make sure that I give send you the links and all of that for the show notes. I would say if you're not ready to commit to something like that, I think being in a group like this where you have guidance from someone such as yourself, I think is wonderful. I would a shameless plug for my own podcast, which you have been on. Coming to find, I interview world leaders and thought leaders on the subject, and we tailor the conversation always for my cohort, which is my women who are like 45 to 65, who are like, "Why is my body changing? I don't like this. I don't like what's happening. I don't want to be aging. I don't like this." What are some of the things that we can do to stack the deck in your favor so that you can age on your terms, right? It's not that you're falling apart. It's not that aging means that you're turning into like a decrepit, inevitable, sack of bones. You can actually absolutely age in the way that you want, and to look the way that you want, and to build your dream body for now and also for when you're 75 or 80. So, better podcast is what it's called.
Yeah, we'll link to all those things, make sure people have access to those resources. And then I have one closing question that I ask everybody, and we just started putting out interviews, so there's no way that you could have seen this coming. So, yes, so I know you're not prepared. That's okay. But the whole point of this podcast, this Health 3.0, is to have conversations with the people who are building some version of it, and that's what I see you doing is building some version of this in the space that you are a specialist in. But if you had the keys to the kingdom and you could change the future of healthcare in one meaningful way, what would it be?
I think I if I had the keys to the kingdom, I think that I would say specifically for women, we don't need more motivation. Okay, we need better models in which to follow that, and that's framework. So that's what we've been talking about today. And I think that there's people who are sort of walking the walk. So I would say like people to model after, and better frameworks as well. I think that we want to remove the moral language from health decisions, and I think we want to help emphasize that your behaviors need to be repeatable over time, rather than going to extremes. Like I see so many women, I'm sure you've seen this in your collective, women who've been eating like 1,100 calories for decades. And they're like, I don't know why, but I keep gaining fat. It's like, let me tell you why. It's because you're not eating enough food. So I think that when we educate, it can help lead to autonomy for the individual. And I think autonomy helps with adherence.
Yeah, amazing. Well, Dr. Stephanie Estima, thank you so much for your time. I really appreciate it. And we'll have to do this again closer to when your book is coming out. You can tell us more about it.
Wonderful. Thank you so much.
That's it for today. So please remember that this is Health 3.0, where precision meets purpose and care remembers its humanity. I'll see you in the next episode.